think since the beginning of the time when we started to see our cases decline in the community, we've been preparing for wave number two. Unfortunately, what we're seeing is we're still in wave number one. So we've done a number of things to keep ourselves prepared and be ready. And I think things like our health system now has at least a 100-day supply of every kind of PPE that we would need based on our highest consumption rates. So we've kind of stockpiled things. We've learned a lot about this virus as we've gone along and how to keep people safe. Just was looking at some data today. I'm excited to say next week I think we're going to hit 2 months since we've had one of our team members test positive, because we've just kind of learned how to keep people safe while they're here in the building and how to treat our patients. So there's a lot of work going on behind the scenes. We fully expect to have bumps along the road as we go through the fall. And really, until we get to a point where we have an effective vaccine, this isn't going away. I think that, some folks thought that the warm weather would make it go away, like we see sometimes with other viruses. That's not held to be true. We don't know yet whether or not, because there's just not enough scientific evidence that, folks who have had the virus, can they be reinfected or not? We're still kind of a little bit in the learning phase on some of these things. But we've learned a lot over the past 3 or 4 months so that we can deal with this if it comes again.